category, which is health and health wellness.
Like use the clicker since it's kind of a slideshow then. That's right. Cool. Hey everyone, my name is Noah and this is Lily. We're both first year medical students at the University of Arizona College of Medicine, Tucson. And we're kind of here today to talk about our experiences with developmental MedCats, which is an organization at the med school, and then how we kind of combined with Special Olympics Arizona to bring awareness and volunteering to individuals with developmental and intellectual disabilities. So if we can flip to the slideshow. Okay, so this is kind of just a little bit of background. So I'm going to be talking about what is developmental MedCats, what is Special Olympics Arizona, and then Lily's going to kind of hit on why should we care about this, and then some specific experiences from med students that volunteered with us. So for a little bit of background, Special Olympics Arizona was created around 1975, and it's grown a lot in the last, 50 years? Pretty quick math on my feet. So it's grown a lot in the last 50 years. Currently in Arizona, there's over 21,000 athletes and around 25,000 volunteers. So throughout the year, we were able to go to events like a basketball tournament with Special Olympics Arizona, and then we were able to go to a track meet. And at those events, we really got to volunteer with the athletes that are involved in Special Olympics Arizona. And Lily and I were at both events, but we also invited medical students to come. So at those two events, we had 15 to 20 medical students that were able to come. They were able to learn how to interact with people with intellectual disabilities. And it was just a lot of fun. So another thing with Developmental MedCats is it is an organization that is also about education for medical students. So we were very lucky to have Dr. Bassford, who's in the back. She was able to come give a talk to any medical student that wanted to come. We basically just had it over the lunch hour from about 12 to 1. And she gave a presentation on how we can best interact with patients with intellectual and developmental disabilities in a clinical setting. Because throughout history, there has been a lot of examples where that population is not listened to. And it takes a lot of education, a lot of learning. And Dr. Bassford is probably the best person in Tucson to educate people about that. So we were very lucky to have her come in. And it was a lot of fun. And then now going to the events that we did with Special Olympics Arizona. So the role that Lily and I kind of played in that was educating on health and wellness. So we would have different activities for the athletes and their families. We had stuff about sun protection, about stress. So we would have them make stress balls out of like rice and sugar and then a balloon. And it was a lot of fun for the athletes. And then we did stuff like yoga, stuff like exercising and stretching before their big races and big basketball events. So it was a lot of fun. And we kind of just want to showcase that we hopefully can have this partnership continue because it's been a lot of fun for the medical students. I know Lily and I have loved it a lot, and we hope that it can keep going. And we kind of just wanted to share that connection with you guys.
Yeah. Hello. Thank you, Noah. And thank you also to everyone who has presented. I just wanted to say that it's been amazing listening to you all. So Noah did touch on what we do with developmental MedCats, but I also wanted to talk about why it's so important. So we did some literature review, and in a lot of the papers we found, there has been a huge gap in education for individuals with intellectual and developmental disabilities, especially for medical students and healthcare professionals. And that really hit home for us because we are medical students. And I feel like we do see that there is not a lot of emphasis on education for how to treat individuals or advocate for individuals. And so, especially with intellectual and developmental disabilities. And so it's super, super important for us as medical students and just in the community to kind of push for this. And so Dr. Bassford is fantastic. And during our talk, we did have some of her patients and family members come and speak to our students. And that kind of opened the door to how you actually bring an individual who maybe is nonverbal, for example, into the conversation so that they can advocate for their own health. And so that's kind of the underlying current of what we do with developmental MedCats as well. So we can teach students, teach medical professionals eventually how to advocate for groups outside of what they're used to. So yeah.
Cool. And then one last thing, obviously it's kind of tough to see because it's in small font, but if you guys want to come say hi after, we kind of have specific experiences from the medical students. So just kind of showcasing that like We obviously got a lot out of it, but also so many medical students got a lot out of it. And we hope that in the future, they can take stuff from this to help them interact with patients. Because no matter what specialty you're in healthcare, you're most likely going to have a patient with IDD. And it's so critical to know how to communicate with them, know how to build trust with them. And it's just a cool thing that we were able to do this year. And we hope that the next generation of medical students can keep going with it. Thanks, guys.
Hello, everybody. I'm Megan,
And I'm Caitlin.
and we are interdisciplinary approach to disability and professional practice interns at the Sonoran Center.
So today we're excited to share our project, and that focuses on creating pregnancy and parenting resources for individuals with intellectual and developmental disabilities.
Our work started with an important realization. There is a significant lack of accessible reproductive health resources for individuals with IDD. This gap in support often leaves people feeling overwhelmed, underinformed, and unsupported when navigating pregnancy, childbirth, and parenting. These are major life stages, and everyone deserves resources that meet their needs.
This project was built around the idea that accessible, inclusive resources empower individuals with disabilities to make informed choices and feel confident in their journey toward parenthood. Through research and collaboration with healthcare professionals and community partners, we developed a series of resources specifically designed for individuals with IDD.
Through our work, we identified key gaps in accessibility and inclusivity. To address these, we focused on using plain language, visual supports, and step-by-step guidance in all of the materials we developed. Some examples of our work are displayed on the poster. In the bottom left, you can see a flyer about the benefits of breastfeeding, highlighting how it can improve health outcomes for both mothers and babies. We also created materials on important topics like sudden infant death syndrome or SIDS, including simple steps to reduce risk. In the center of the poster, we have featured a flyer about eliminating pregnancy barriers for women with disabilities, with tips on advocacy and navigating the healthcare system.
Another piece we want to highlight is the myth-busting disability and sexuality flyer. That addresses common misconceptions about disability, sexuality, and parenting, and it aims to promote more inclusive conversations.
As for outcomes, we developed multiple accessible resources designed not just for individuals with IDD, but also for healthcare providers and professionals. We work to share these materials with clinics, support programs, and community partners to help broaden their impact.
And then looking ahead, our next steps include finalizing and sharing these materials widely with community partners, gathering feedback from individuals with disabilities to continue improving accessibility, and expanding distribution to reach even more people.
And that is it. Thank you guys so much.
Hello, everyone. My name is Jocelyn Watson, and I am a Master's of Public Health student, and my concentration is in family and child health. I've always had a passion for working with the IDD community and with maternal health, so this was a perfect project to fuse both my passions together. So my APE experience for my master's report is titled Project Care, focusing on the challenges and adversities that women with IDDs face when in maternal health spaces and how to build up resilience and empowerment for these individuals. So the overall goal was to just gain more information about pregnancy, maternal health, and reproductive health among women who have IDDs, and to hope for future inclusion with this demographic of women. So going about the methods for this project was to understand what resource gaps and what demographic gaps exist in the maternal health space for women with IDDs. and how to identify the best methods and practices to effectively communicate information to this demographic of people. And my colleagues on my team also touched on that with their resources in the previous presentation. But for my project, I dove into literature reviews and wrote a gap analysis report based on my findings. And then from there, doing more resource creation based on those results. So I conducted a literature review to see what research and data is out there, and there's not a lot. This is due to a plethora of reasons. It could be due to internalized stigmas and biases that exist still in the medical health field that are just not including women with IDDs into these research projects and just excluding them in general. And based on the findings from that literature review, in my gap analysis report, I found that there was limited resources on pregnancy, parenting, and maternal health for women with IDDs. And there's just not a lot of information out there for them. And I wanted to create resources and information that have those what existing maternal health data and statistics on the research that is currently out there, and then building up a resilience toolkit and empowerment resources for this community to utilize when they are going to seek out medical care, and how to talk to providers and how to get the healthcare that they deserve. So in general, next steps, I believe that we need to just continue these conversations, bring in more awareness, put out more provider trainings and everything to build up inclusion for this demographic of women. People with IDDs in general are overlooked in the medical and healthcare space. So especially pertaining to maternal health and reproductive health. So continuing projects like this and continuing these conversations is the best way to push for inclusion. And just to also, for our research and future data, we need to put in more inclusion criteria for these women and for this demographic to be included, so they can have more information to advocate for themselves and to learn what risk factors they are more exposed to. Thank you for listening to my project.
Okay, we also have Isha, who was unable to be here with us today. She's actually presenting at a conference, so she also recorded her presentation for us today.
Hello, my name is Isha Mother, and my project looked at how state policies affect cancer care access for individuals with intellectual or developmental disabilities. So the reason why my team wanted to look into this is because previous research has found that individuals with IDD are actually diagnosed with cancer earlier, but their survival rates are much lower than the able-bodied community. And this is a very disturbing statistic to find. Our team hypothesized that maybe this could be because state policies and Medicaid waivers in these states are not addressing these 6 social determinants of health well enough. And these social determinants of health can really affect health outcomes and cancer care outcomes for this IDD population. So some examples of the social determinants of health can be seen here in Figure 1. These include education, economic stability, social context, living conditions and physical environment, the healthcare system, and then also food security. So the goal of our project was to identify and understand gaps in these state policies that inform the screening, diagnosis, and treatment of cancer for people with IDD, and how that might affect their cancer outcomes. We chose to look at the Medicaid policies and waivers in states because much of the IDD community gets their services through Medicaid. And just as some background, Medicaid is a state state-controlled health system where they provide services to their eligible population, and their eligible population includes individuals with a certain financial income, as well as individuals with disabilities. And like I said before, the IDD community usually falls into that eligibility criteria. And then in the 2000s, states were given the chance to expand their eligibility or keep it the same under the Affordable Care Act. And our team decided to look at the state Kentucky, which chose to expand their eligibility and serve a larger population. And then we also chose to look at Georgia, which chose not to expand. And our project wanted to look at how a Medicaid expanded state, Kentucky, and a Medicaid unexpanded state, Georgia, actually addressed the social determinants of health in their policies and in their waivers. So to turn your attention to my method section, this is how we kind of answered our research question and how we tackled our project. So the first thing we did was conduct a policy scan of Kentucky and Georgia. And these policies were not necessarily Medicaid related, that they were just policies that existed in their law. And we looked at the specific health policies in each of these states. Georgia had about 260 health policies, but only 28 of those actually mentioned IDD or healthcare or cancer care access. In Kentucky, there was about 89 policies that mentioned health, and only 66 of those actually addressed IDD, the IDD community or cancer care access. Then we moved on to the analysis of Georgia waivers and programs and Kentucky waivers and programs. And just for a simple definition of what a waiver is a vehicle that a state can use to test out new or existing ways to deliver and pay for healthcare services in Medicaid. So these are specific to Medicaid. And we can kind of see the results of that in table 2. We looked at the 17 Georgia waivers and the 15 Kentucky waivers, and we found that in how well they address the social determinants of health, Georgia had 0 policies that talked about education. Kentucky only had 3, and you can kind of look at these numbers to kind of understand how well these waivers actually address the 6 social determinants of health that are so key to the IDD community's healthcare and cancer care access outcomes. And finally, the last thing we did was conduct in-depth interviews of policy advocates in both Georgia and in Kentucky to understand if the policies and waivers we actually reviewed are efficient when on the ground. And we found that through these interviews that they were not necessarily the most efficient. Some barriers that came up were health literacy, advocacy, provider education, transportation, and rurality. So in conclusion, there are some differences between Georgia and Kentucky when it comes to how well they address the social determinants of health. For the future, we hope to disseminate our results to both Georgia and Kentucky, and to also collaborate with disability organizations to bring about awareness and change to provide better support for the IDD community when it comes to their cancer care outcomes and their access. Thank you so much.